Greetings class, my name is Jason Sork. I'm a student of the McKendree University Nursing Baccalaureate program. And I'm delightful today to be able to present to you the review and outcome of the presentation that I delivered November the 18th of this year at the Marion, Illinois VA Rural King Annex building. The topic of my choosing was on chronic disease management related to diabetes and chronic kidney disease, CKD. The presentation was delivered through lecture format along with the utilization of visual aids such as handouts and poster boards. My choosing of this topic was correlated to personal experience as an RN related to my treatment of patients who were diagnosed with these chronic diseases and seeing firsthand the detrimental effects that these diseases have on their bodies and on their families. Furthermore, personal experience from my own family of individuals who have suffered greatly with type 1 diabetes and chronic kidney disease. The target population was aimed at individuals who are at risk or are diagnosed with diabetes and or chronic kidney disease that are residing in Southern Illinois. By utilizing the United States Census Bureau, I was able to find out many detrimental factors within this region. And also tapping into Healthy People 2020, I found that many health determinants were amazingly seen that affect individuals' health outcomes. For example, in Southern Illinois, we find that this area is a poor economical region. This is resulting from a high unemployment rate, which correlates with individuals living below poverty level, which prevents them from being able to access communicable resources, partially because of lack of knowledge and partially because of lack of motivation. Furthermore, many of these individuals are depressed. Many of these individuals are despondent. And many of these individuals are suffering from these risk factors, not realizing what issues that they have going on in their lives. So therefore, I found it incumbent upon myself to be able to explain these things to my class. What was useful in my presentation was the usage of simple terminology that was understandable to all age groups. Furthermore, being able to compare nursing terminology or medical issues in correlation with everyday topics such as chronic kidney disease is a disease that affects the kidney's filtering system. I compared that to simple filters, whether it be an old filter or an air filter. I had one individual give me a feedback that she loved the comparison of these two factors, the chronic kidney disease and filters, and she said this would be great for individuals in the home health region. My findings were more or less established through usage of Healthy People 2020, the Center for Disease Control, the Task Force on Community and Preventative Services, the National Institute of Diabetes and Digestive Kidney Disease, the United States Department of Health and Human Services, and also the United States Department of Veterans Affairs, VA. What I was discussing were the findings, which are what are the risk factors, what are the symptoms, what resources do we have available, what evidence-based interventions can be utilized. Furthermore, I utilized the SMART pattern goals, the SMART goals pattern in order to establish 3 short-term goals and 1 long-term goal. The short-term goals, in summation, were that every participant would be able to identify 3 risk factors related to kidneys disease, chronic kidney disease, and or diabetes, and also to be able to identify accessible community resources. Furthermore, they would be educated on healthy eating patterns, such as proper consumption of fruits and vegetables. Furthermore, the long-term goal was that 50% of these participants would be able to still successfully identify 3 health determinants, such as risk factors and also be able to identify 3 community resources, along with being able to identify 50% of treatment plans available for diabetes and chronic kidney disease. In summation, I would say that the purpose of the presentation to the class was to help enlighten them, to see the need to be educated regarding chronic disease management, and to be able to see the need for preventative measures. As I looked in the class, I could see that many within the class probably had at least 1 to 2 risk factors within their own lives. And I thought it was very useful that I delivered this topic because I felt like it would be greatly needed for even their own personal use. The evidence-based interventions were based pretty well on the Task Force on Community and Preventative Services. And what I used was, one was the United States Department of Health and Human Services and the CDC recommended the chronic care model. It's a reliable approach to utilize, and the main thing is it has a systematic approach that's able to provide more engagement from clients with their care provider. This is used with technology such as cell phones, Bluetooth, etc. Furthermore, it helps on self-management support. It helps on tracking processes. It helps to improve communication, which also results in better health outcomes, such as lower A1C levels. As stated, this evidence-based intervention engaged clients more and gave them better productive results. And I wanted to use this intervention in order to engage the participants to realize that in our non-acute care setting at the Rural King Annex building, they would be able to engage their physicians. They would be able to engage their community resources. They would be able to live more productive lives. Continuing on, I utilized the 2002 Task Force on Community Preventative Services Plan that used diabetic self-management education to adults in community gathering places because it had sufficient evidence improving glycemic control of individuals diagnosed with type 2 diabetes. While delivering this message, I stated that many individuals would say, Jason, you are only implying about treating diabetes. But, as stated earlier, I wanted to bring about the link between diabetes and CKD. I pointed to the poster and stated, if you would notice on causes of chronic kidney disease, 42% of the causes are from type 2 diabetes. So I stated to the class that by treating type 2 diabetes, we are also preventing CKD. By treating type 2 diabetes, we might be also treating CKD. And during the entire process, I encouraged questions. I encouraged feedback. Unfortunately, the class did not engage into that until the closure, which I will be discussing later. This self-management education was able to respond to psychosocial needs such as loneliness, lack of support, because in community gathering places, they were able to have more of a advocacy, so to speak, that they would be able to speak with one another and have the ability to be able to express any concerns with one another. Furthermore, I utilized the Community Preventative Service Task Force 2014 recommendation of combined diet and physical activity promotion progress for people at risk of type 2 diabetes or at risk. These interventions had strong evidence because they were effective in healthcare processes such as weight loss programs. And in connection, I began to discuss community resources. By being an employee of the VA, I found it needful for me to see what resources the VA was able to display and offer to their veterans. One was the My Health Vet program. This is a program that engaged the first intervention. It helps veterans be able to be in more contact with their care providers. They are able to become more engaged in their plan of care. Furthermore, we have the MOVE apostrophe program. And this MOVE program is a weight management program. It also utilizes healthy eating patterns. And what I wanted to do was combine these three interventions in these resources and show the patients and the class how interventions can be entangled with every program that we have available. Furthermore, the VA has an electronic library which has a slew of resources, evidence-based, with strong evidence that these are effective, that they can use in their everyday lives. Furthermore, I discussed what if you're not a veteran? What is available for you? So I began to discuss healthcare facilities, such as our local region, which have El Dorado, Illinois, Farrell Hospital, Harrisburg, Illinois, Harrisburg Medical Center. Marion, Illinois, not only has the VA, but has Heartland Regional Center. Furthermore, I stated we have a recreational activity center known as the Hub on Main Street in Marion, Illinois. And I expressed how that by being able to identify these resources, we are able to engage with these resources, which is able to promote healthier living. As for the handouts, while I was discussing these things, I utilized from the VA, we had a paper, a handout, Small Steps for Eating Healthy Foods. What I like is, in order to engage our community, we have to be able to speak in terminology, in terms that they're able to understand. And as I stated in the class, I compared kidney failure, the filtration problem, to simple filter problems like air filters or oil filters. Many individuals are able to understand with these topics. They're able to understand what they need to do by comparing simple objects that they have everyday contact with. For example, a half a cup of cooked rice or pasta, same size as an ice cream scoop. 2 tablespoons of peanut butter, the same size as a ping pong ball. Furthermore, I was discussing on healthy eating patterns, how we're not to eat fried foods, but how we're to bake, broil, and how we are to cut the fat out, eat more lean meats, poultry, such as chicken. A discussion was made about what if you go out to eat at a restaurant, what to do. And I stated many times we have to use common sense. We have to not eat as much as we'd like. We'd have to look at the menu and use our knowledge skills. Furthermore, the second handout was getting active, with another page, keep track of important information such as exams, tests, and immunizations. And what I was trying to correlate with, I was trying to explain to the class not only the symptoms that we're dealing with diabetes and CKD, but what we can do with these disease processes and how we can live with them or help to prevent the full impact that can affect our bodies. For example, I stated there might be an individual that will be diagnosed with CKD 5 years from now, but with proper motivation, with proper healthy eating patterns, with proper healthy living, the CKD can be delayed for 10 years. And I stated, this may not seem like much for you or I, but for somebody that is prone to get this, this is a great mountable goal for them, that they have prevented themselves from catching this disease or being diagnosed with this disease for 5 years. Furthermore, discussion was made on the types of diabetes, type 1, type 2, what type 1 does to the body, such as being an autoimmune disease, how it affects the pancreas not to produce insulin, type 2, with a majority of individuals being diagnosed with it, and how it affects insulin from being able to reach the cells that it needs in order to balance our blood sugars. I proceeded by discussing through the poster hyperglycemia, hypoglycemia, what we need to do when having these illnesses, these symptoms, such as if we're thirsty, if we have what we would call polyuria, having to urinate constantly, or being lethargic, weak, or blurred vision, or like hypoglycemia, fast heartbeat, confusion, we're sweaty, we're nauseated. And using common terminology expressing monitoring our blood sugar, which enabled me to express about a glucometer, what a glucometer is, and how, using simple terminology, expressing, you use a lancet to prick your finger. Of course, they have other healthcare facilities that are more advanced that have glucometers where you can utilize it and prick yourself any part of the body. But I expressed that one little drop of blood, it goes into the strip's in the machine, and the machine reads your blood sugar. It is amazing how the delivery of a topic affects the outcome of an individual's understanding. And as I was delivering this topic, I realized how this affected me. I would be asked, would I change anything? The only change that I would recommend for myself would be even being more prepared. Because, unfortunately, one question was asked regarding the A1C level. My mind went blank. I did state this, and I had it on my poster board about A1Cs and the level, the usual aim to keep below 7. And I expressed what A1Cs were earlier, how that it was more or less your blood sugar average for the last 3 months. But my mind went blank. But fortunately, I had enough about me at that moment that I expressed the resources I used, stating this to the individual. I said, I may not be able to give you what you exactly need right now, but I can give you the resources where I found it. And what was amazing was one of the participants noticed this. She was reading this, which I'm glad. The visual aids were very productive. And by her seeing this, we had a proactivity within our class. Furthermore, I was asked, well, if an individual is diagnosed with diabetes, how long do they have to be compliant with a diabetic diet? And I stated, for life. I stated, when you are a diabetic, you have to be compliant with what your doctor states. Furthermore, by expressing that, I explain also how that diabetes and chronic kidney disease affects us with our medications. How we have to read the labels, we have to understand, is this detrimental for me to take, or will this benefit me? And how to engage your doctor in asking he or she whether you should take this medication or not. What worked well was the engagement. I believe that the delivery of the presentation was excellent. I'm not trying to state this because I gave it, but I felt like it was proactive. It was able to reach individuals, where no individual could state that I was speaking above them or even below them. I would have to say a great takeaway in this presentation was how it enabled my critical thinking skills. And I felt like I could be that much more of a nurse advocate for my clients that I see. I feel like this experience has enabled me to not only grow in my critical thinking skills, but it also enables me to become, or have a hunger to become more knowledgeable for my patients. I've always written in our assignments, nurses are advocates, or nurses are educators. And as I've always stated at the VA, I have to be in control Because if I'm not in control, who's going to be in control? And if you're a nurse, you know what I'm talking about, because we're speaking about many times the hostile work environments, the chaos that goes on in our everyday nursing careers. But I feel like with the delivery of this presentation, it makes me that much more wanting to not only have a bachelorette degree in nursing, but also be that much better of a nurse by utilizing the resources that I'm becoming more acquainted with and being more knowledgeable where there are no issues where my mind may go blank. And I would say it's been a privilege to discuss this today, and I wish all of you the most best educational experience you can find through McKendree. Thank you.